Let's give this patient some great Botox treatment. So let's start off with the frontalis muscle, that forehead. Let's get rid of these forehead wrinkles on a fairly young millennial patient, but late 20s, and she doesn't like wrinkles in her forehead, doesn't want to ever get them. So what are we doing here? We are injecting the frontalis muscle. Dosaging is so important. You've got to know the right dosage for this and also the pattern so that you get a good distribution across the frontalis muscle to put the entire muscle to sleep for about 3 months. When that muscle stops contracting, the skin's natural condition over it is nice and smooth, and this patient loves her Botox, tolerates it very well. Look how we are cleaning her up, always pushing it into the muscle and away from other muscles that we do not want this Botox to relax, because that's when you get side effects like droopy eyebrows or eyelids and other kinds of problems. Now the glabellar area, first one was the procerus muscle, now the corrugator muscles. Look how we're holding the tissue. We are holding our thumb against the upper orbital rim to really isolate the corrugators and make sure that the Botox is only going into those muscles. Light dabbing, that's all. This redness is going to go down in no time. Now the crow's feet, the lateral orbicularis oculi. Get rid of these crow's feet here. Stretch, we like to stretch these so that the ComfortTox syringe, which is the best syringe, sharpest one, and patients barely feel anything. Really go ahead and stretch that syringe a little bit, put a little tension on it so this slips right underneath there. Always looking for veins. Always looking for vasculature. We don't want to bruise patients, but it is inevitable that sometimes you may do that. Now, the masseter injection. Make sure you know where the anterior and posterior border, you want to be right in the middle. If you get to anterior or posterior, you could have problems with other muscles here. And really grab that masseter and you push that Botox in. You go all the way as far as you can with the ComfortTox syringe, and that will go ahead and do it. She just had lip enhancement, and she swells quite a bit, and this is the swelling is already down a few minutes later. What are we doing here? We are doing a Botox lip flip, and what we are going to go ahead and do is very superficially in the superficial fibers of the orbicularis oris muscle, we are going to quiet that down. The mechanism of action here is that the bottom muscles, the more meaty part of the orbicularis oris muscle, that does not have the Botox. That's why we're keeping it very superficial. And you got to learn this technique, because otherwise you push it too far into the lip muscle and then it doesn't work, and then the patient has problems with lip competence. Here we are very selectively going ahead and putting the superficial fibers of the orbicularis oris to sleep. That allows the bottom fibers, the strong part, to really push out that lip a little bit more, because that's something called muscle recruitment, and that actually results in more lip show. Combined with the lip enhancement that she's had, is still a little bit swollen, even though it's come down quite a bit in just a few minutes. Combined with that, gives the patient beautiful lip height in combination with the volume that she had. So you've got to learn this, and great techniques, all AAFE exclusive techniques in terms of combinations and how we do this. Time for you to get AAFE certification trained today.